Speaker of the House of Commons Sir Lindsay Hoyle issues a statement criticizing Rachel Reeves, the Chancellor, for declaring new fiscal policies to the media before presenting her budget statement to MPs. In today's video, we'll watch and discuss this clip while also reviewing all of the most recent news from across the nation. However, before we do that, please hit the like button, subscribe to the channel, and become a part of our rapidly expanding community. Thus, as said in the introduction, the House of Commons speaks in a statement. Lindsay Hoyle chastises Rachel Reeves, the Chancellor, for revealing new economic measures to the press prior to presenting her budget proposal to MPs. Watch before the next business has a brief statement to make. In media interviews last week, the Chancellor announced that she planned to introduce changes to the fiscal rules relating to the measurement of the public debt and the funding of daily spending through tax receipts. These are significant new policy announcements with wide-ranging implications for the government's fiscal policy and public finances, and ministers should expect to face proper sustained scrutiny when these announcements are made for the elected members of this House and not for the American news channels. It's unacceptable. I want to treat this House with the respect and decency it deserves and don't want it to go on. I don't support either side. It is completely unacceptable to go around the world telling people that these members should receive better treatment because they were chosen by the nation's citizens. In addition, isn't it ironic that the opposing side was the one complaining to me when the previous party was in power? Get your act together, everyone. Less than 2 days before Wednesday's budget, Rachel Reeves has issued a fresh warning about the state of the NHS in a new jab at the previous government. The budget's impending tax hikes and borrowing increases may not be enough to reverse 14 years of harm to the health service, despite causing anxiety across the nation. Let's get to the urgent question. What do you think of the Speaker's remarks? Let me know in the comments. Although Health Secretary West Streeting has stated that it will take time to improve the funding situation, Reeves cautioned that the Chancellor is anticipated to invest billions of pounds in the NHS, including £70 million for radiotherapy machines alone and £1.5 billion for new surgical hubs and scanners. The Treasury has stated that billions of pounds will be invested in technology to help boost productivity across the service, and splurge will probably go some way towards meeting Labour's pledge to deliver 2 million extra NHS appointments annually. However, when asked if the budget would fix the NHS, the Chancellor responded, "I don't think in one budget you can undo 14 years of damage, but in this budget we're going to provide the resource necessary to deliver on our manifesto commitment." In addition to increasing the capital budget to its highest level since 2010 to invest in the new scanners and radiography equipment, Reeves claimed her plan will assist deliver 40,000 additional appointments every week to help reduce the massive backlog. In another Tory dig, she said from St George's Hospital in South London that staff members were still using equipment purchased during the previous Labour government that ought to have been replaced by now, which hindered their productivity and efficiency. Therefore, in addition to funding reform in the health service, we also need to see modern equipment to get the most out of the qualified staff who are using tools that are inappropriate in 2024. As she unveiled the budget on Wednesday, Reeves pledged that we will be remembered as the administration that pulled the NHS out of its worst crisis ever, got it back on its feet, and prepared it for the bright future that lies ahead. Reeves will acknowledge the need for difficult decisions on spending on welfare and taxation and change the way national debt is measured to give her more flexibility to borrow, she said. By making those decisions and putting our public finances and our public services on a firmer footing, we can wipe the slate clean after 14 years of chaos and instability under the last government. But Streeting, on a joint visit to the hospital with the Chancellor, said the extra cash might not prevent avoidable deaths and another winter crisis over the coming months. I can't promise that there won't be people waiting on trolleys and corridors this winter. There are people in that position already today. We will start planning for next winter this winter to make sure we see continued steady improvement in our NHS, and what this budget will enable us to do is arrest the decline in the NHS and start fixing the foundation, so we can not only get the NHS back on its feet but make sure it's fit for the future as part of our long-term plan. I can't pretend that we will be able to wave a Labour magic wand and make all of those issues go away this winter. There will still be real issues, but we won't downplay how big they are. We are already helping system leaders, especially in areas that typically face the most difficulties in the winter, to try to reduce the risk this winter. We also asked if the budget would lower the number of preventable deaths in the NHS. Streeting retorted that, despite his assurances and the Chancellor's promises, I believe that 14 years of Conservative failure have kind of led us to the worst crisis in the history of the NHS and have broken that fundamental promise that the NHS will be there for people when they need it. Although it will take time to turn things around, patient safety and taking the necessary steps to keep people as safe as possible will always be my top priorities this winter and throughout the year. Doctors have warned that Reeves's proposed pension tax hikes will cause irreversible harm to the NHS. The British Medical Association has stated that more harmful changes to pension taxes would be disastrous following years of doctors being forced to cut back on their workloads or quit the NHS because of pension policies. Finally, a transport chief from North Yorkshire claims that the government's new £3 bus fare pricing restriction is still hurting rural towns and would increase worker costs by £500. It comes as the budget now includes Prime Minister Keir Starmer's pledge to maintain a cap on bus ticket prices, even though they are 50% higher. He claims that Starmer has complied, but only after pleading with rural communities like ours to keep the cap in place. It is incorrect that we have had to fight so hard to preserve an initiative that is especially crucial for bus services in communities like ours, and the little savings this will produce means while the major cities have invested billions in transportation, the decisions feel like a penny squeezing from rural areas, and the cap will continue to climb by 50%, further hurting working people. For an average worker who commutes every day, the added expense will be about $500. We're in a very rural part of North Yorkshire, here in the moors, and this is just one of the communities that could be left cut off if we do see this breakdown of the network in North Yorkshire. Kel Duncan stated in an interview that the fare cap has been a lifeline for many services that are barely surviving here in North Yorkshire and really across the country. It's been incredibly popular, and we've seen an increase in passenger numbers. The new £3 cap is now set to remain until the end of 2025, but without the cap, Duncan warns of a cease in services. Please share your thoughts about the topics we covered in today's video in the comments box below. If you haven't already, please like this video and subscribe to the channel for more British political news. Thank you, and be careful.